Okay then, so we're on the Services tab, and we've got a list of the different services that are available. You need to select the service that you're going to look at. I'm going to look at Common Ailments to start with. You will notice that there are 2 stages for most of our services. The first one is patient registration and the second one is the consultation. Please make sure that you register the patient in the correct registration module, because these are service specific. Some of them are locked because services are available to different groups of patients. It might be to do with age or gender. Sometimes the service is locked depending on where their GP is registered. So for example, Common Ailments is available to anybody with a GP in Staffordshire and Shropshire. Some other services like emergency supply, you just need a GP somewhere in England. So make sure you use the right registration module. Pick on. So in the Services tab, we've selected Common Ailments. We're in the Patient Registration module. Automatically the date comes up as today, which is great if you're doing live recording, which is what we're all aiming to do. But if you did it yesterday and you're just entering the details, you can actually change the date on here, and you can see it will change that. If we're looking for a patient, if the patient has already been to the service before, you can look and you'll find the details from a drop-down menu. Anybody with the same name will start to show up. Select the correct patient and it will already put some information in there, so you don't have to enter the address again. If the patient doesn't come up in that search box, then you will have to type the name and you will have to enter things like date of birth and gender and the postcode and find their address. If you know the NHS number, you can add it here. If you don't know, then you need to type in unknown, and then it will ask for the GP practice. So we'll put the start of the name and it will start to come up with these, and you just choose the correct GP practice. It's asking whether the patient has consented. Make sure that you're just aware of what they're consenting to, because for this service they're consenting to the service but also to sharing information with all the other pharmacy providers and with NHS England, because the other providers need to know how many times they've accessed the service, because there are limits to how many supplies you can make for each condition in a year to any patient. You need to check that they've got the consent. Tell us who's consenting, so was it the patient or a parent and guardian or the representative? If it wasn't the actual patient, add their name in this box. And if you were entering a few patients at once, you can click save and enter another. But if you're just entering the one patient, then you would click save. Okay then, so we're on our Services tab here, and we're going to now, having registered the patient, we're going to actually enter the consultation. So again, make sure that you're on the correct service and just click on the link and it will take you to the module that relates to the Common Ailments service. This is stage 2 consultation. Again, the date defaults to today's date. So let's say we're doing it live, that would be fine. If we did it yesterday, we would click in the box and change the date on the calendar. So we start to type the client name in, so we know it was Pluto, so we'll put that in. And the service is coming up with anybody with that name, so make sure you choose the correct patient and then that will be linked to their registration. We ask the GP practice every time, so even though you may have put this in once already, it's important to put it in again in case the patient has moved. And then we start to answer the questions. How did we know that they're registered with a GP in Staffordshire and Shropshire? So we can say that the patient's known to pharmacy staff. Do they pay for the prescriptions? Well, this service is for people exempt from prescription charges, so you would enter the reason that they're exempt from charges. And just like you look at for any prescription, have you seen the evidence? We'll say yes. Usually the patient will attend in person, but if it's a child, there needs to be a parent or guardian with them. Or sometimes the pharmacist may decide it's appropriate for a patient representative to come in. So you might have somebody with really severe diarrhea, for example, that a patient representative might come on their behalf. So for this module, there isn't an enrolment for the pharmacist, but it will ask for your details. So you start to type your name in there and it's not going to search for it because it's not an enrolment. So you would actually have to put your details in. You would add your GPHC number in there, not XX, it has to be the real one. And then we record the member of staff who made the supply, because usually this service will be provided by a healthcare assistant under the supervision of the pharmacist. So we'll put a name in there. And then we're going to detail what actually the patient came in with. So we've got a list of all of the conditions that the service covers. So you would choose an appropriate condition. It asks if you've given medication. If you say no, just carry on. If it says yes, you will be asked to record what medication it was. Did you refer them onwards, yes or no? If you did refer them, we ask you where you referred them to. So if it was somebody then you discover they had some very worrying symptoms, you might send them off to A&E, or it could be that you gave them advice to see a GP within a certain amount of time. Any medication that you supply, you can do up to 3 to treat the symptoms. You would start to type the information in here. So let's start to type paracetamol. And it will search, and then you choose the item that you gave. You can choose, as I say, up to 3 medication. If you are treating threadworms, you put the medication in there, and then you simply have to add the number of family members you've treated in there. We're just collecting some information about the service, so where were they referred from? So let's say this person was told by another healthcare professional, and we do ask where they would have gone to if they couldn't have accessed the scheme, so they might have gone to the GP. And when you've put all of that information in, you just click your save button, and that's you done. You'll see it's now appeared as your most recent provision there. It's interesting that if you've missed any information that the record has to have, you will get a red highlighted box, and that will tell you to go in and put the extra information in. But that's it saved. That means the records inform outcomes. It means at the end of the month that will be included in the claim and the report that goes to the Commissioner.